quality of implants you use in your procedures?
There are different kinds of breast implants, but in Turkey, I mean, personally, for about more than 20 years, I've been using the mentor prosthesis. As far as I said before, there are different kinds of prosthesis from Brazilian, France production, but the mentor prosthesis is one of the safest one in terms of physical quality, the reaction that it would cause. This is the best reputation. This has got the best reputation. So out of more than 20 years, I don't remember one single case having any problem with this.
How do you decide on the shape of the implants?
The shape of the implant, actually there are two kinds of different shapes. One is round, the other one is T-shaped. T-shape is only for the selected cases. That means if the patient has got almost no breasts. So when you're trying to do is not only augmentation, but sort of giving a shape as well, which means the fullness on the lower pole, but not fullness in the upper pole. In those cases, usually very young patients and have got problem with the breast development, you would choose T-shaped prosthesis. But in the majority of the cases, patient has got no problem with the shape of the breast in terms of, as I said, the lower fullness is okay, but hasn't got enough fullness on the upper pole. For these cases, always the round prosthesis is the right one. And again, in some transgender prosthesis, I mean from male to female, because the male breast hasn't got any difference in the upper and lower pole, and in those cases, as I said, the T-shaped prosthesis is not only augmentation, but creating a breast shape as well. Well, it looks, anatomical. That's why it's just has got, a sort of attraction for people, because people would say, okay, this is the more breast shape, so I would go for this one. But when you put the prosthesis in the breast in the operation, you would notice that the lower pole projection would be too much, and the upper pole would be looking sort of hollow. That's why in the majority of the cases, our choice is round prosthesis. Especially at the same time, when you do the uplift, actually you are just making the shape more anatomical, more desired, and actually what you want is just for the augmentation. That's why round prosthesis is for the majority of the cases.
How do you decide on the size of the implant?
The size of the prosthesis, the decision about this is the most difficult, most challenging part of it. And personally, I have any problem with the breast prosthesis patients, it's almost always about the size of the prosthesis. Because when you have some enough experience about how to do the procedure, it's quite straightforward. Apart from some hematoma or bleeding for some reason, I don't think any problem will be coming out the breast prosthesis operations. But the size is something subjective, and actually, honestly speaking, there is no way that you could just estimate the exact size that the patient has got in mind. This has two sides of prosthesis problem. One is patient would not exactly be able to tell you exactly how much augmentation she would like, and on the other hand, the prosthesis staying on the table is something different. When you put the prosthesis under the breast, because it will lose some sort of projection. I mean, it's just something like this. But when you put it under the skin, it would be you would be seeing everything that the projection is giving, or fullness. But when you put it under the breast, the fullness will be some sort of get lost. So from our side, it's that the best way is always trying out. But on the patient side, the problem is patient is not actually would tell you what exactly she wants. Well, of course, she could come up with some pictures, but these pictures would not be actually corresponding to the problem that you will be dealing with. Because the chest size, chest type, and if there's any asymmetric problem, that patient is never exactly the same with the woman that in the picture. But patient would have some difficulty in understanding this. That's why we are just talking about the bra sizes, just roughly. So, and when you get into the operation, you just, for example, you decide in about a range, about 300, 325, 350 something. And then you just put, on one side 325, on the other side 350 for instance, and then you just see what the exactly, amount, the size for the patient would be best. So the answer is there is no straightforward answer to this question. That's why we need to talk to the patient. We need to clarify what exactly patient is expecting from this operation. Yeah.
Does the breast augmentation procedure leave any marks?
Well, of course, because any procedure in surgery biologically would leave a mark. But there are actually 3 ways for the breast augmentation in 3 kind of incisions. One is the periareola, around the nipple areola, which one that I used to use. This one, 10 years ago, perhaps even before, because I believe that whatever you do around the periareola incision, it will always cause some sort of irregularities or asymmetries on both sides, because biologically healing is not something symmetrical. Although you make the incision symmetrical and the dissection symmetrical, there is no way to guarantee that the healing and the scar will be symmetrical. That's why I go for the inframammary incision, which is anatomically sort of a cleft we have it there. In every woman you have just this area separating the chest and the abdomen, so it's easy to conceal. And as for the axillary access, I've never tried that because technically it's not possible going through that little opening and then make sure that there will be no bleeding in the middle, because actually this area in the middle is the area that would be bleeding and would cause some problem. So with the endoscope, your vision is quite limited, and as I said, there is no way that you would be even coagulating if you see any bleeding there. So this is the major problem in terms of just early postoperative complication, which is hematoma, or in the long run having the capsular contraction. They are all about something to do with the bleeding. That's why you need to make sure that there is no bleeding when you leave the pocket. Where the pocket that you put the prosthesis in. So axillary access is something, as I said, I would say too risky. So comparing to periareola and inframammary incision, as I said, inframammary incision, both anatomically and surgically is easy to get in, and the scar will be always better than whatever you do compared to the periareolar incision.
How long is the recovery period after breast augmentation procedure?
When you put the prosthesis under the breast on top of the muscles, the recovery period expected about 5 days maximum, because there will be not too much stretching and pressure on it, and the skin or the breast will be absorbing the expanding pressure. So if the patient hasn't got any problem with the bleeding or infection or something to do with the early postoperative period, the recovery period is quite short compared to the rest of the operations in plastic surgery. I would say maximum 1 week would be enough. But it doesn't mean that that after 1 week operation the patient will be exactly back to her normal life. But that means she would not need any more medical attention, but she needs to be a little bit patient to see the result.
And could you give some brief information about healing process, like detail?
Healing process, as I said, apart from hematoma, bleeding, which comes out in the first or the second day of the operation, and the infection never occurred to me, so I have no experience about this. Because if you're working, in a sterile condition, and if you're sticking to the some principles, I don't think the infection would be a problem. As for the healing process, well, I don't think it requires any special attention as far as everything goes fine.
Okay. Do breast implants change the sensitivity on breast skin and nipples?
Not at all, because actually the breast prosthesis is sitting under the breasts. This operation has got nothing to do with the breasts. Well, when you do periareolar incision, well, in some cases you could do some harm to the nerves, so that the patient after the operation could have some problem with the sensitivity around the periareolar. But with the inframammary incision, I'm not expecting any problem like that.
What is the possibility of slipping and flipping after the procedure?
That is only applied to teardrop prosthesis, because the round prosthesis is symmetrical everywhere, so there will be flipping always something, I don't know, I can't even imagine that, because the pocket should be snug enough so that the prosthesis will not be able to flip around. As for the slipping, it's nothing to do with the prosthesis, it's something to do with the pocket. So if the pocket is too large, the prosthesis would be slipping to the armpit. But if you keep the pocket, small enough, the prosthesis would be just, sliding over just 1 centimeter or something. But as for the teardrop prosthesis, I don't have personal experience with the teardrop prosthesis flipping around, slipping around, but it has been published, so I think some people have got a problem with that. But I'm telling you again that with the teardrop prosthesis, the only thing that could happen is just the prosthesis could be turning a bit around. So it's not actually slipping around or flipping around.
Okay. And what is the possibility of permanent chest pain after the procedure?
Not at all. Never heard of it.
When will patients be able to wear normal bra after procedure?
2 or 3 weeks.
And how long do you recommend using support bra after the procedure?
Well, personally, I don't believe any support coming from the bras, because if you do the surgery in the right way, if you create the pocket in the right way, I don't think you would need any bras. Well, I'm giving the bras to patients because they are assuming that the bra has something positive influence on the result. But personally, I don't think it has anything to do with it. In the long term, having a not special bra but something sports bra would be just something doing good to the breast tissue, not the prosthesis. Because say in 10 years, naturally the normal breast will be sliding over of the prosthesis. So these bras are not for the prosthesis, for the rest of the breast.
So do you think breast implants increases the risk of cancer?
Not at all. Last year in 1993 I started a big project in USA, so they just want to clarify all questions about the breast prosthesis in terms of breast cancer. And I don't know exactly, but in about 5 years or something, there was sort of legal regulations about using the silicone implant, silicone prosthesis in USA. But after this project has been completed, now it's clear that with the FDA approval that this prosthesis has got nothing to do with the breast cancer.